Hi, I'm Dr. Spandana. I'm an oral implantologist. I run my own practice in Khajaguda, Hyderabad. Today I have here with me Dr. Janki.
Hi, Dr. Spandana. I am Dr. Janki and I am a periodontist and an oral implantologist and I practice in Miapur.
So today we've joined together to talk about this topic that is very close to both of our hearts. We've spoken about it multiple times and I think this is a topic that all dentists should address.
Yes.
Not only dentists but other professionals of the medical fraternity also should kind of think about this. And the topic we'd like to talk about is the image of a dentist. So when we think about ourselves, what we do, what is dentistry for us, who is a dentist, what do I do, who am I think of myself as first and foremost a doctor, right? So I'm a healer. When patients come to me with a lot of pain, I want to heal them, I want to make them feel better, I want to relieve them of their pain. I think of myself as a designer, as an artist, because I'm designing their smiles to make them feel more confident, to make them feel, ready to take over the world. I think of myself as an engineer. I kind of engineered the entire treatment plan. I make their crowns, I make their bridges, I put in their implants. There's so much, engineering, science involved in it, right? But do you think that the patients look at us like that? Do you think the patients look at us as artists, as designers, as doctors, as engineers? No. I think the most common thing that we have experienced is that the patient walks into our clinics and one of the first things that the patient says is that I'm scared. I'm scared of a dentist, I have dental anxiety, I'm scared of pain, and I'm
scared about for my pocket.
Yeah, right. So the general feeling is that it's very expensive. I come here for one problem and then you tell me 10 other things.
Yes.
Yeah, that is wrong with me, so you'll end up making me spend a lot more. Yeah, so that is the kind of image that we have, right? So we have an image of being someone who inflicts a lot of pain. We are thought of someone, even in general, when I meet new people in networking forums, in any gatherings, and I tell them, not only a patient, but even general public, when I tell them that I'm a dentist, that, I hate dentists, I'm so scared of dentists, and I am very, I'm very worried about the dental, I have this problem that I've not been addressing because I'm so scared of the dental chair. And it is so sad, it hurts me so much that kind of a reaction probably a cardiologist won't get, right?
Yeah.
When you say you're a cardiologist, a person is like so excited that, oh cool, you're a cardiologist, but that reaction we don't get as dentists, whereas that should be the reaction.
Yeah.
And today we are here to talk about how we can kind of bridge the gap between what we think we are and what we think we are doing for the society versus what the patients think of us. So tell me, Dr. Janaki, what has your experience been? Why do you think that patients think of us this way?
So firstly, the main problem with most of the patients, not all the patients, most of the patients, is that they come to us only when they have pain and they do not come to us for a regular checkup or just to have a look, like how they go for a blood test yearly. That is not there with dentists. When you come to me with pain, which almost always means that it's either we have to do a root canal for you.
Yeah, it's reached a point where the treatment itself is extensive, right? It's not something that I'm just, doing a cleaning and I'm sending you away.
Yeah, so like if you come at such a stage, I either have to do a root canal or I have to extract your tooth and give you a bridge or an implant, which obviously is going to take some time, and
it's going to be both painful because it's a surgical procedure.
Yes.
Not necessarily painful, but it is an extensive procedure.
Yeah.
And it is also going to cost you a lot more money than a filling would have if they would have come at a much earlier point.
If you just drop in at least once a year, not even twice a year. If you drop in once a year for a checkup, we can diagnose early for your caries and your gum issues, the tartar buildup and everything. So I think that is the main issue, that patients do not want to come unless there is a major problem.
Yeah.
That is why we
So
have
the
that
moment
negative image.
they come at a stage where it's already too late.
Yes.
Obviously you're going to be, so if you do your general checkups,
Yeah.
you know that you can probably get done with a simple filling, a couple of fillings, maybe you have a
Yes.
cavity here and there, maybe you need a round of cleaning. But when you come only when, and that's the perception, right, that most people think that अभी तक तो दांत दर्द नहीं कर रहा है,
तो
it's
सब
not
ठीक है.
hurting. So if it's not hurting, why do I have to go to a dentist?
Exactly.
Because it's fine, I'm able to chew, it's not hurting, so
Yeah.
let me not put myself through that, because I know
Yeah.
the moment I go to a dentist. But that's the thing that's wrong. Because
Exactly.
the moment you do that, you're already putting yourself in a position where you'll need more treatment than
Extensive
when you would
treatment.
have extensive treatment. Then
I have
when you
had
would have,
patients who come to me and like, I have this hole since 6 months,
Yeah.
but you waited on it, which you
Yeah,
shouldn't have.
which
If
you shouldn't have,
came
absolutely.
earlier, say within a month, maybe we could have done a filling.
Yeah.
Maybe we could have saved it.
Yes, and I think the other thing that has contributed to this image a lot is the history of dentistry.
Absolutely.
So the dentistry earlier, just about 10-20 years ago, was not as evolved as it is today. We did not have the kind of technological support that we have today. We didn't have the kind of instruments. We didn't have the kind of the setups that we create these days. Are such luxury dental clinics are available.
Yeah.
This was not the case just 10, 15, 20 years ago, maybe
True.
50 years ago, when our parents used to go to a dentist.
Yeah.
So a lot of people are so influenced by their experience with their their parents' experience with their dentists,
And maybe their own childhood experiences.
Exactly.
Where they must have had like an extraction or traumatic extraction, probably. So all that, yeah, it does contribute. Plus, like the word of mouth, which spreads that,
Yeah, so I remember my aunt she came to me and she had to get a wisdom tooth extracted, and I know for a fact that the extraction was extremely painless, but just because she was so anxious for the extraction, she started sobbing and shouting on the dental chair.
Yes.
And she knows me personally, she knows the work I do. I do most of my extractions, and I know that most patients say that it has been quite quick and quite painless, whereas her case was not even that severe. And I know for a fact that as a child, she has seen my grandfather, which is her father, go to a dentist for an extraction. Obviously without any kind of care and concern, what kind of a dentist am I going to, right? And that's definitely something I want to talk about. But to continue the story, basically he went to a dentist and he got this tooth extracted, but a small root piece which was infected was left inside the jaw, and he had so much pain. The doctor didn't bother to, back then obviously taking x-rays, all of this, RVGs and OPGs and CBCTs that we have today did not exist.
And also the expertise that
exactly, to even
read
an X-ray was not there. So he could not figure out why he's continuing to have pain. He did not realize that he left a root piece behind. And my grandfather would be in so much pain that apparently he would break his head against the wall in that pain. And as a child, when you see that, you have a permanent scar left in your head that dentists are going to cause me pain. Anything related to the tooth, that's it. And that fear I saw that day, and I felt so bad that she doesn't realize how much dentistry has evolved. And because of that anxiety, her pain threshold has already dropped. Right? So even for a simplest of things, she's so scared that even if I touch her, even if I, retract her cheek to see, she's already like screaming in pain, which is so sad. And the other thing what you said, which makes so much sense, that they must have had a bad experience as a child. Why? Because why did most patients who are in their 20s and 30s now come to me and say that, as a child I went to a dentist, ever since I'm scared? Why? Because your parents did not have the awareness. There's an entire different field called pediatric dentistry. Pediatric dentists are most capable of dealing with a child.
They specialize in that.
They specialize in that. 3 years and so many more years of experience only dealing with children, because it's not the same root canal. It might be the same procedure, but the psychological, conditioning that is
Yes.
required for a child is very different from what is required for a patient.
an adult, yes.
For an adult patient. So if you don't know that, you take them to the closest, and that's what it is. Most patients want to choose dentists who are close to
Close
them.
by.
They are inexpensive.
Yeah.
They are, generally
Inexpensive, but provide the best treatment.
provide the best treatment. I don't know how both work together side by side.
Yeah.
They also want to they want to be nice. They want to be, they want to quickly just do whatever it is that you want them to do, and you leave.
Yeah.
But you are not understanding. I mean, the patient. Here I'm appealing to the patient. The patient does not understand that is not how it works.
Exactly.
If that patient would have been taken to a pediatric dentist, her first dental experience would have been positive. And then therefore that dental anxiety that has set in their head regarding the dental chair and the dentist would not have been there, and she would have had a more positive image
Outlook,
that she
even
would
in-
have associated
Yeah.
with the dentist. So specialty based dentistry is definitely something
Yes.
that was lacking in the past, because of which general dentists would try and do everything and very quickly, and therefore because of several people having such bad experiences, I think that's the reason why. Another reason why patients have this
I think
negative
bad
image.
experiences spread faster than a good experience.
Yes,
Yeah.
it's always pain that you end up remembering for much
Exactly.
longer.
Yeah.
But do you think that in all of this, I know there is a lot of blame game that we are doing on patients, but do you think we should take some of the blame?
I would agree with you, and we should take some blame because sometimes we fail to explain the entire treatment process to the patient, where in layman terms where they would understand. We talk in our own terms sometimes where they don't understand. So we need to give them some time and be patient with them sometimes. So yeah, these things need to change. Plus we need to educate them even more. By just putting up some videos or posters, it's not going to work. We need to sit with them, explain the basic things, like basics like brushing, because you must have seen cases of severe attrition, abrasion, where they are brushing for 5 minutes, 7 minutes, which is not required at all. They need to finish it under 2 to 3 minutes.
Or even situations where they've been brushing twice a day, but there's so much
much
tartar
plaque.
buildup.
Yeah.
So clearly, even the basics of how to brush has
Yes.
not been properly told to each and everybody on this earth. And please don't take me wrong. I don't think that this is a situation of our city or our country. It's a global issue. Wherein doctors in general, again, I'm not talking only about dentists, I'm talking about generally medical professionals, have not made the effort to explain the science to the patient. See, essentially we are doctors, right? We are not marketeers, we are not meant to...
We're not business people.
We are not business people, we are not sales, we are not finance guys, we are doctors, and we are responsible to educate our patients about what is the right method to do what.
Right.
So even a doctor, for example, my father suffers from, whatever, he has some lung issues, he has some heart issues, he has, high BP, he has diabetes, multitude of issues. I take him to a doctor for whatever, maybe the problem that he's having today. He listens to my dad for probably less than a minute and starts jotting down, a diagnosis and medicines, probably not even give a diagnosis. And that's something that really bothers me. As a medical professional, when a person is coming and telling you that this is my problem, he's talking about the symptoms. Why is it that you are not giving him firstly, you are not defining those symptoms for him? Why isn't there a diagnosis that is being given? And then based on the diagnosis, why aren't you telling him the history of why is it that he has this issue?
Right.
What are all the issues that he has? Cumulatively, what are they leading to? And what is the issue that he has? Break it down for him. He's a layman. He's a normal person. He's not studied as much as you have. And and then talk about what are all the steps involved in his treatment, right from starting his treatment to his maintenance. Even dentists. Why is it that as periodontists we learn so much about maintenance? Why is it that patients are not given that the thought process that okay, you've come to me for a gum problem. This is the category of gum problems that you belong in, and therefore this is the treatment right now. This is the treatment for the next 2 years. The moment you say that, you have first of all given a lot of education to the patient, and he knows what to expect. So I feel that one of the reasons how we are responsible is also because we thrive in this ambiguity that we've created. We've created a certain sense of ambiguity and aura regarding a dental or a medical professional. We want to stick to that. We want to stick to that extremely, mysterious aura that medical professionals have. That, okay, I understand something that you don't. You understand it because you've studied.
Right.
Maybe he knows something that you don't.
Absolutely.
So why don't you take this time? First appointment, I believe, is so important because of this reason, right?
Yes.
Because the first time the patient walks in, what is the way we are taught in dental schools is that address the chief complaint. So patient comes, says I have pain in my lower right side tooth.
Yeah.
You say that you take an X-ray, you look at his mouth and you say that you need a root canal.
Yeah.
You give him an appointment for a root canal, or you start root canal right away without explaining what does he have that means that he needs a root canal, why has he reached this stage, what is a root canal. If people don't know how to brush only, what do you expect them to know what a root canal is?
But
Right?
I also think that it's not only us, even if we try our best to educate the patient, the perception is that teeth are not important.
Yeah.
That is the first thing that needs to change, because teeth are not important. They don't realize that it's because the teeth, you are chewing your food, which helps you in your digestion. Tomorrow, if you don't replace your missing teeth, you're going to have gastric issues and so many other issues, digestive issues, issues related to your weight and everything. So teeth are really important, and not just teeth, even your gums. Like bleeding gums is not normal.
Yeah.
People come to me and say, yeah, my gums have been bleeding since 6 months. You shouldn't wait for that long to come to a dentist when your gums are bleeding.
Yeah.
So
when they do that, what I'm trying to say is that if you take that time to basically explain why are your gums bleeding and what does it take for you to solve that issue, then the ambiguity is lessened.
Yes.
The trust factor in you is increases.
Yes.
And you made a very lovely point, because patients think that teeth are not important. Right?
Yeah.
I think I'm sorry to say this out loud, but I think it needs to be addressed. I think the medical professional, medical fraternity is partly responsible for this.
Okay.
When parents, children of even doctors, generally parents, right at the level of school, the child says that I want to be a doctor. And you tell them about the different kind of doctors that are there, right? Do you actually tell them about dentists? Because medical professionals don't treat dentists as doctors. There's
there's no mutual respect.
There's no mutual respect. And this very famous joke that you're a dentist, you're not a doctor. I am a doctor just because, I chose to be the doctor of a mouth. That does not mean that I don't have the DR in front of me. That does not mean that I've not spent the 7-8 years that any other doctor would have spent to learn the art, to learn the science. I have a degree that says that I also have to take the oath. The medical profession itself tends to downgrade you, right? And even generally the patients, public, society, they say that, medicine mein seat nahi mila, dental le lo. That is so sad. When I decided to be a dentist, I decided it in my 8th standard that I want to be a dentist. I went for my braces treatment. I was just so much in love with that entire, the dental chair and the dental setup, the doctor, the sterilization, the cleanliness, the procedure. It was all so fascinating for me that I developed this passion that I stick to even today. The problem, I think that's where we as dentists are responsible. That mostly, it's arguable, and I am not trying to generalize, but this is this has been my experience, that mostly people who wanted to do medicine, wanted to be like, let's say, a pediatrician or a gynecologist or a whatever, did not get the seat and they ended up taking dental.
Probably.
They do not have that kind of passion that maybe you and I share for dentistry. And therefore they, at that point only that medicine nahi mila to dental, so you're already downgrading yourself. Right? The second thing that people usually perceive, as you very rightly said, that the mouth is connected to the rest of the body. It is
Exactly.
not that there are barriers, right? There
It's
are
the
barriers
mirror
that
of your entire body.
exactly. There are no barriers between your mouth and the rest of the body.
Yes.
I mean, there is no awareness amongst people, even amongst medical professionals. I mean, dentists know this because we read it, but do medical professionals and generally the people, the society, do they know that bad oral hygiene can actually worsen your diabetes?
Yes.
It can worsen your heart disease. It can, it can worsen your, I mean, as a pregnant, and that's another thing,
Yeah.
you, while we were discussing the other day, you put out a very good point that, let's talk about pregnancy in general.
Yes.
Now, when couples start planning their pregnancy, they go to a doctor
Yeah.
and they get all of their checkups done, right?
Done,
Let's
everything.
make sure that there's no problem in my heart, there's no problem in my bones, there's no problem in my liver, there's no problem in my
My
thyroid.
vitamins are on
point.
Yeah.
I don't have any deficiencies, and
Exactly.
all of those blood tests are done. But do you get a dental screening done before
Nobody.
you decide?
They come during the pregnancy when they are
Exactly.
6, 7, 8 months pregnant, and I can absolutely do nothing to help you even if I want
Exactly.
to. So it's it's better that before you plan and
Yeah,
do
if you
something,
go
at least
for
come
a
for
dental
a screening.
So again, I'll tell you an example. My sister,
Yeah.
she has been taught that she has to brush each tooth 20 times and she spends a good 2 to 3 minutes in brushing.
Okay.
She has had spick and span teeth for her entire life.
Yeah.
That woman, a person like that, comes to me during dentistry crying, saying, I mean during her pregnancy,
yeah.
crying, saying that I have pain. And I was shocked to see that she has a huge gum swelling and a cavity.
Yeah.
A woman who sparkling white teeth, dude. Like she's so meticulous with her oral hygiene. But because you know that
Yeah.
during pregnancy there is hormonal imbalance and you tend to develop
It
so
happens.
many.
It happens for most of the women. There is some amount of gingival swelling. There
Yes.
is some amount of
so
changes.
when you, but most people don't know this. Medical doctors, general doctors don't know this, so they don't educate their
Educate the
patients
patient.
that okay, you've come to me for your blood tests.
Yeah.
Please also go to a dentist for screening
For a general checkup.
because people do not know that when you come to me after you're pregnant, and again, I'm not generalizing, but a lot of people tend to develop dental problems during their pregnancy because of
yes.
these hormonal imbalances. You come to me, I cannot take an X-ray. I cannot, give you more than half the medications that I would give a normal person.
We can only prescribe a simple painkiller. That's it.
Exactly. I cannot do more than half the procedures. I can hardly do some elective procedures and some kind of a
basic cleaning.
Basic cleaning. And how will that relieve you of your pain? So you're basically having to go through your entire 9 months of pregnancy with pain, with very little medicines that you're allowed. Even painkillers, NSAIDs, etc. are not allowed. So you're suffering. So had there been awareness amongst not only the society but even doctors,
Absolutely.
Medical fraternity, telling patients, educating them that please go for a dental screening.
checkup.
So that's how I think medical professionals have added to this entire image. They themselves don't believe dentists are as important as they are. We have added on to our own image in such a negative way.
There's a lot of there's no standardization with the pricing. Like if I'm providing you a good service, good material, a good quality crown, of course I'm going to charge you for that. But if you go somewhere else and he or she is not providing the same quality of the crown or the material and they're charging lesser, you cannot bargain, or you cannot come and say that person is charging only this much, why your charge is so high. But you fail to understand that I'm giving you a good standard, I'm giving you good
because
quality.
There is zero awareness. There's zero awareness about what it takes. That's what I'm saying. People don't know what it takes to do a cleaning, what it takes to do a filling, what are the different types of filling materials.
Absolutely.
I may be doing a composite filling and charging X. Somebody must be doing it in half the price, but probably the patient doesn't even know that as an adult patient he's getting a GIC. Which is ridiculous.
Yeah.
Why are we practicing without any standards? There's no benchmark. The dentistry is so different. Dental clinics, so your clinic is different from my clinic, which is different from another clinic. In the same street, there are several different clinics practicing different types of dentistry. Like you would go to a coffee shop, right? You go to a Starbucks, you will have this kind of a, a coffee. If you go to a very boutique dental, a coffee shop, you will have a very different kind of a coffee. Maybe in some, but it's actually become like that. There is no standardization.
There's so much window shopping.
There's so much window shopping. And the other thing that I really think we should address is the whole, corporatization of the medical field.
Yes.
A lot of corporates who do not understand anything about dentistry, they're business people.
Yeah.
They're business people opening a business. For them, it's a business, and they're hiring dentists. But what is the quality of the dentist? What is the experience of a dentist? What is the education of the dentist?
And there's so much pressure on the dentist there to complete their targets.
Exactly. There are targets and there's sales. Why are we as doctors who have taken oath to help the society running behind sales and marketing? Targets are being given to doctors and freshers out of college.
Work.
Yeah, which leads to unethical work, right? You may need only a small filling, but then he'll push you to do a root canal because he has so much target, that he has to achieve. Yes, they do bring in a certain sense of standard.
Right.
They standardize their clinics. Let's say you go to an XYZ corporate clinic, and there are 60 of them out there in this city. If you go to maybe, 3 of them, they will have the same standard in terms of their experience. And how are they building in standards? They're building in standards through the process of billing, invoicing process, the way they've been, received in this thing, all the kind of paperwork that they are being done. But is there really standard in the work that is being done?
Not at all.
Because you hire freshers right out of college, and let's face it, BDS, MBBS teaches only a little. As doctors, we are expected to have a lot of experience. We are expected to, even with masters, and the same example, right? So you go to a BDS doctor with your child, and he does not know how to deal with your crying child who's so scared of where he's been brought to, and what are all these sharp things that are being put in my mouth, and why are there 3 people? He doesn't know, the child doesn't know, but you are expecting the BDS doctor, because of your own unawareness, to treat him the way an MDS, pediatrician would do. And that's ridiculous, Even social media, Bollywood and Hollywood movies, this entire notion of a dentist, the moment you say dentist,
you're not a real doctor.
Yeah, the joke that you're not a real doctor in some of the most famous movies, the general, the way you create the image of a dentist being a very frustrated, a very, tired, unhappy,
only doing work, just only doing the work just to get money out of you.
Exactly, and basically not being the most friendly or the most approachable or the most happy person that you can come across. But it's not the reality.
That's not true at all.
That's not true at all. When you meet us outside of our workplaces, and we are so different. Why is it that we are not able to be our true selves at our workplace? Why is it? Because I feel is that we are all struggling to make ends meet.
I would totally agree.
And this is again, so we feel that somewhere out there, let's say in the US or in UK, it's all better. Doctors are having a better life there because they earn so much, etc., etc. That's not true. That's always the sense that particularly South Indians have, that the grass is greener on the other side, and the US is some kind of a fairyland where everything awesome happens. But I've seen such botched up work, such frustrated dentists, thanks to the insurance policies over there. The dentist earns very little. Even if he does earn a lot, because of the insurance policies, he wants to try and expand. The same thing that happens in our country, because we earn only so much from one patient, we are automatically forcing ourselves to see 20 patients in a day.
Right.
A human mind can only do so much. When you're doing your first composite filling at 10 in the morning versus your last composite filling at 7 in the morning, the evening, there's going to be a difference.
Definitely.
So let's try and understand that. Let's try and address these issues. Let's try and first of all accept that this is the reality. Dentists are not getting the respect that they deserve.
They are not getting their due.
Their due respect. They are not getting, both from people,
patients
and from the medical fraternity in general. understand, accept that this is the reality, this is your image in the world, in your patient's eye, in the doctor's eye who doesn't even know what dentistry is all about.
Exactly.
And let's try and address that and change that without feeling bad. Like I was saying, when you address this issue, how do you address this issue? When the patient comes to you, first appointment, you're talking to him, give him a comprehensive treatment plan. Tell him that yes, you've come to me for this problem, but these are all the things that are wrong with you.
Yes.
Why we don't do that is because we're scared. If I tell him that these are all the issues, they'll run away.
Yeah.
They want to go to a dentist who just addresses his issue and then leaves it at that.
Yeah.
Doesn't bother to build a personal relationship wherein he is your personal dentist. Let's do that.
We need a more holistic approach.
Exactly. Let us think of ourselves as leaders in this community, wherein we have to take up the responsibility and the accountability of educating our patients, of informing our patients, spreading the awareness of what it means to take care of your oral health and how it affects the rest of your body. How a missing of a single tooth can cause so much havoc in your joints, in your throat, in your head, in your neck, your posture. Our posture is it depends on our our oral health.
If a single filling is not well adjusted, it's going to cause so many problems, so many back issues.
Exactly.
Not immediately, but eventually,
a small high point. Let's understand that. Let's not take our own field so lightly and continue to, invest in this propaganda that dentistry is not important. Dentists are people who, inflict a lot of pain. Dentists are people who are very expensive. Dentists are people who are unethical. Let's please, so this entire podcast for me has been, for us, has been an effort to basically an appeal to dentists and to other doctors of the medical fraternity to let's start taking our field seriously.
And it is a respectable field.
It is a respectable field. Let's try and get that kind of respect from our patients. Let's try and elevate our practices. Let's try and build our practices with a lot of passion. Let's try and, there is so much support.
And constant, keep upgrading yourself in whatever way is possible.
Exactly. There's so much, evolvement in the dental technology today. Try and update yourself so that if you are updated, you can update your patient about what are all the, how has the dental field evolved over the years and how painless the procedure can be, how minimally invasive the procedure can be. Please try and build a personal relationship with your patient. He's not a customer. You're not a sales guy,
absolutely.
Right? You build, if in our earlier era when medical field was in its golden phase, we had family doctors. Where is the concept of a family doctor or a family dentist? Why did we have that? Is because there was a certain sense of trust and respect towards your doctors, certain sense of trust, and here the patients are looking at us and saying, "Acha, ye nahi to wo nahi to koi aur." You are not understanding anything, not trying to develop any kind of rapport with your patients. Then why is it that he will not stick with you? He will move on.
Of course.
Right? So that is the entire point of this podcast, where we want to appeal to the medical fraternity and the doctors to take, to try and bridge this gap between what we think we are versus how our patients are perceiving us. And I think the moment this gap is bridged, then a lot of our issues will be solved, and these are issues that need to be addressed and they need to be solved.
I'm sure slowly but surely.
Hopefully. Thank you so much.
Thank you,
Dr. Jan.
Thank you, Dr. Sandana.